in a major boost and to address the acute shortage of doctors in various government health centers in the state, the Meghalaya government recently completed the recruitment process of 400 doctors or medical and health officers. The recruitment process of the doctors was carried out by the Meghalaya Medical Service Recruitment Board. It may be reminded that the Meghalaya government notified the constitution of the Meghalaya Medical Services Recruitment Board on November last year. Talking exclusively to Meghalaya Legislative Assembly channel, here's what the Principal Secretary, Health Department, Sampat Kumar said.
As you are aware, the state government has set up a Meghalaya Medical Recruitment Board. It was the decision taken by the cabinet, headed by our Honorable Chief Minister.
So the idea was that, how to really streamline the process of recruitment, and especially given the, especially the background with COVID and various things, we also realized the importance of providing a healthcare, better healthcare. So we do require better systems to provide the healthcare. So this Meghalaya Medical Recruitment Board is one of those systemic reforms brought in by the state. So this kind of a system was there in Tamil Nadu, and as a state, in fact, they have been doing extremely well in terms of public healthcare. So we also have gone there, learned the systems, how they are implementing, and we have brought and we presented to the state cabinet, and state cabinet has approved this. So this this actually has because health services cannot be kept vacant. So we need to have efficient system. So this particular recruitment board helps us to really focus on what are the existing vacancies, how actually we can make sure that these vacancies are filled in, because one of the problems for the state is that also we don't get enough specialists. So we do require inefficient systems to really encourage and promote more and more people to come and serve in the state. So this is like as part of the whole measures, I think this has been done. And the board headed by the secretary and and also the director of health services, joint director. So all of them were involved, and they did a good job in collaboration with the Negrins and in different other organizations to really do well. And this has been done again by using a computer-based test, which is a very important thing, because again it provides absolute transparency, and it also has provided some weightage to the work that the doctors have done in the rural areas, and and their experience has been taken into account. Separate weightage is given for how many years of service, what kind of a weightage that you would get. Similarly, weightage is also given to those who have pursued the post-graduation. So this is again that also has basically provided a lot of encouragement for the specialists also to apply for. So all this put together, we could able to complete the process within a month.
So also, what does this mean for the state? I mean, 400 doctors coming in. All this while, we had, like you mentioned, shortage of doctors. So what does it mean for the state? How will you use these doctors?
Yeah. So one good thing is that, first of all, most of these doctors were also working under 3F. 3F means basically on a temporary appointment. So all of these doctors, they're also looking for this opportunity. So I'm sure, in fact, just now before you came, the doctors who came here, they were very happy. They were saying because they're very happy because one is that it is done efficiently and very quickly, and number two is that it's also giving a lot of motivation to those young doctors. I think this actually would translate into more committed and dedicated service to the people. So it's called public service motivation. So if you are motivated, your ability to discharge your services would be much better. So I think this would translate into a better healthcare. And we're also, in fact, the state has a lot of plans, to really strengthen the health system. As I just said, this is one of the many things. Yeah.
So will these doctors be sent to the rural areas and?
Yes. Most of them actually will be serving in rural areas, and we're also actually sending them for special trainings. For example, Some of these MBBS doctors require training on how to handle high risk pregnant mothers when they come for delivery. So for that there is a emergency obstetric care training for 6 months. We are sending them to Tamil Nadu, and there is also we are also training them on anesthesiology basically, so that in case rural areas, if an operation has to be done, you require any anesthesiologist. So we are training them for 6 months course for that. We're also going to train them on especially the radiology part, how to, especially most of the pregnant women are required to be go for ultrasound screening, so that if there are how the child is doing in the mother's womb. So all that requires some additional training. So all these doctors would be trained in this. We are also actually have a plan to train them in the family medicine, so that they can provide better training. So we are also tied up with the CMC Vellore, so who are going to train a lot of our doctors and the family medicine too.
So my next question is based on that only, whatever you said. Since the MOU has been signed with the Tamil Nadu government to train our doctors from here, so what about the doctors who were sent? Are these the same doctors, 400 doctors?
Yeah. These doctors, most of them are these doctors only will be sent there, and when they go there, we also have to again some the training vacancies will arise. So we'll recruit some new doctors too.
And what is the duration of this?
6 months.
6 months.
6 months.